We start this hour with the latest warning from the World Health Organization. Its chief scientist says the new Omicron variant could become dominant around the world. But that doesn't necessarily mean we'll need to reformulate our vaccines. The number of countries detecting the coronavirus variant is increasing every day. But the WHO also says it's too soon to know if Omicron causes more serious illness and people shouldn't panic. Well, let's bring you up to date with some of the key developments. First, the surge in South Africa, where the variant was first identified, has accelerated. Doctors say there's a higher rate of admissions of young children. They're not sure why. Next, Germany is introducing tough new rules for the unvaccinated. Only people who've been jabbed will be allowed in restaurants, cinemas and many other shops. And the United States has introduced strict travel rules. International passengers must now take a COVID test no more than 1 day before they travel, regardless of their vaccination status. And here in the UK, a review of vaccines has found that Pfizer and Moderna are the most effective booster jabs on top of the initial 1 or 2 doses given. So let's get a bit more on this now. We can speak to Dr. Emma Hodcroft, a molecular epidemiologist at the University of Bern in Switzerland. Thank you very much for coming on the programme.
Very happy to be here.
So, I know it's early, so I'm going to ask you some unfair questions, but how worried should we be at the moment?
This is a hard one to balance right now. The situation in South Africa is different from in many countries when it comes to their vaccination status, previous infections, and their recent caseload. And so it's a little hard to know if Omicron might have taken advantage of some of these things to spread so quickly, and what this will mean for other countries. Having said that, though, it's better to be over-prepared than under-prepared. And so I think the WHO warning for countries to prepare themselves for possible rise in cases is a good one, particularly when so many of us in Europe and the US are already struggling with really high case numbers. We certainly need to be prepared if Omicron could add to that burden in the coming weeks and months.
OK, well, let's take that as a possibility then. Say the impacts aren't as severe, you don't get as ill, especially if you've been vaccinated, but it's more transmissible, there are more cases. What's the potential downside of that?
So first of all, I think this is something we need to be really careful about talking about this information. At the moment, it's quite anecdotal. We have to keep in mind South Africa has a very young population. Young people are less likely to have bad outcomes. And also, severe outcomes don't manifest immediately. It might be a week or two before we see some severe outcomes. So we shouldn't too early assume that this is a milder version. However, it is possible that this could happen, and that would be encouraging in some ways. But it's still important to remember that if this is much more transmissible, that means it could infect a very, very large number of people. And even if a smaller fraction of those are hospitalized or die, a small fraction of a big number can still be a very big number that could still put pressure on healthcare systems.
OK, let's look at the vaccines then. Given the amount of mutations in this variant, people are obviously worried that the vaccines will be less effective. Is there any evidence so far?
So far, we unfortunately don't have any news yet on an update about how effective the vaccines might be. The concern here is that this new Omicron variant has changes in the spike protein, which your body uses to recognize it and mount a good immune response. So those changes might make it harder for your body to recognize the virus and fight it off. But this is speculative at the moment. Though some of these mutations we know from previous variants are certainly not good news, it's possible that there could be other trade-offs, like the virus might be slightly less fit, less able to transmit quite as well. Unfortunately, those are not looking like it's the case at the moment. But it's also possible that with the current boosters that we're already rolling out, that we might be able to maintain enough protection that we're keeping people out of hospital and from dying. And that's really what we want to be focused on here, is keeping those severe outcomes down.
OK, and important not to jump to any conclusions. Dr. Emma Hodcroft, thank you very much for coming on and talking us through that. Thank you.